Serendipity. That is what comes to my heart when I think of how I read the book, The Black Angels, the untold story of the nurses who helped cure tuberculosis. This book was published in 2023. The book celebrates works that affirm the highest value of the human spirit. Black angels refer to black nurses who worked at Seaview Hospital, situated in Staten Island, New York. These nurses earned the name of Black Angels, black because of their skin color, and angels because they broke racial barriers and risked their lives to take care of the people with TB when the white nurses had abandoned them. Authored by Maria Smilios, adjunct lecturer at Columbia University, Mailman School of Public Health, this book has helped immortalize the work of the Black Angel nurses. Soon after I read the book, serendipity was at play again. We were on our way to New York to attend the United Nations General Assembly high level meeting on antimicrobial resistance, which was happening hardly half an hour drive away from Seaview Hospital. And I could see the exhibit Taking Care Black Angels of Seaview Hospital. Meet its co curator, Gabriela Leon, and also meet one of the Black Angel nurses, Virginia Allen, who is over 93 years old now, and she drove by herself in her car meet us at Staten Island Museum. This exhibit is open for all till December 29, 2024. During 1913 and 1961, Seaview Hospital was one of the four hospitals out of 29 hospitals in New York City that would hire black nurses. These nurses served the patients diligently, braving the dangerous risk of catching the infection themselves. Gabriela Leon was kind enough to show us around the exhibit. Before the mid 20th century advent of modern antibiotics and advances in public health, the core strategy to combat illnesses like tuberculosis was rest, sunlight, fresh air, and good nutrition. This concept was central to the design of Seaview Hospital, which was a sprawling hilltop campus built 400 feet above sea level for TB treatment and containment. When Seaview TB Hospital opened in 1913, TB was a leading cause of death among New Yorkers, killing over 10,000 people in the year 1910 alone. With 1,402 beds, it was one of the largest TB hospitals in USA. It took a staff of about up to 800 people to keep the campus running, from nurses and doctors to cooks and cleaners. Everyone was essential and at risk of catching TB. In fact, surviving hospital records suggest that 3 to 7% of the nurses working there contracted TB while they were employed at Seaview, compared to less than 1% transmission of infectious disease in modern hospitals. Here you can see TB patients in their balconies in Seaview Hospital. During 1913 to 1961, Seaview Hospital, which also doubled up as a sanatorium and is situated in Staten Island, New York, was taking care of people with TB, though there was no cure for the disease back then, till the mid 1900s when the antibiotic era began. And to top it all, the white nursing staff refused to work there for fear of contracting the dreaded disease. Black angels took care of everyone with love and integrity. In 1951, Seaview Hospital conducted the clinical study of isoniazid, one of the two most powerful first line anti TB drugs even today. The hospital's Black Angel nurses and other support staff conducted this study, counseling the patients and seeking consent from every study participant, administering medicines, monitoring and observing the patients, and reporting the results to the two doctors in charge, Dr. Edward Robertsek and Dr. Irving Selikoff. This was a landmark study as isoniazid was shown to work in curing TB while when other therapies failed. It could be used in combination with other drugs for improved treatment outcomes. Dr. Edward and Dr. Irving received the prestigious Lasker Award for their work, but the Black Angel nurses and support staff who risked their lives to help conduct the study did not get recognized for their stupendous work. This real story of isoniazid study and how Black Angel nurses were made to slip on the blind spot when it came to awards and recognitions was one of the drivers for Maria to write her book. Mamie Daniels was a patient at Seaview Hospital from 1948 to 1952. Interviewed by author Maria Smilios for the Black Angels book, Mamie Daniels was the daughter and niece of sharecroppers who made their way up to Staten Island during the Great Migration. She fell ill with tuberculosis and was admitted to Seaview Hospital when she was 17 years old. But she was one of the lucky ones who got cured of TB and was just discharged from the hospital in 1952 at the age of 21. Here you can see poems written by patients of Seaview Hospital, which are also part of the exhibit. Medical cabinet of Seaview Hospital had bottles of herbal medicines, mortar and pestle, etc., as you can see in the picture. Medical treatment at the beginning of the 20th century was in a transition period. The medical pharmaceutical industry was still new, and many treatments relied on traditional remedies such as botanical extracts. Natural remedies like chamomilla and rose geranium oil were used to treat symptoms of tuberculosis and other illnesses, such as upset stomachs or headaches. Some nurses used family practices and traditional herbal medicines to ward off illness and prevent their families from catching TB. The antibiotic revolution began only in the 1940s with the discovery of penicillin in 1928. But the first drug used in the treatment of TB was streptomycin, that was discovered in 1943 and helped reduce TB mortality. And then came isoniazid, expanding treatment options for various diseases, including tuberculosis. What a humbling moment this was for me. Reading the TB patients register of 1913 to 1961 from Seaview Hospital. Patients came from not only across USA, but also other countries like Italy, Estonia, Russia, Ireland, Sweden, Turkey, Scotland, Spain, Puerto Rico, and others, as has been mentioned in this register. But it was only the black nurses who took care of all, as white nurses refused to work back then. Also, note the last column in the register, which tells how many patients died. A century of medical advancements has changed this last column to a large extent today by helping save lives. When she was 16, Virginia Allen, a Black Angel nurse, and now my friend too, whom I met in Staten Island this year, moved to Staten Island to live with her aunt, Edna Sutton Ballard, who was a registered nurse at Seaview Hospital. Inspired by her aunt, Virginia took a job as a nurse's aide in the Children's Hospital there while studying nursing at the Central School for Practical Nurses. She worked at Seaview Hospital from 1947 to 1957 and later went on to work in various nursing roles, including as a private duty nurse and a surgical nurse. Even today, she is a force to reckon with and remains a community leader with numerous affiliations. This is Stiversa A. Bethel, 1912 to 1983. Stevessa was from Ann Arbor, Michigan. She moved from Michigan to New York to attend the Lincoln School for Nurses. She graduated in 1935 and moved to Staten Island. She joined the World War II Cadet Nurse Corps in 1943 and then went back to school, graduating with a BS from Columbia University. In 1950, she transferred from Harlem to Seaview Hospital and became the superintendent of nurses. In recognition of her services, Stuyvesant Bethel Healthcare Museum was established at Seaview in 1983. Bethel died just months after attending the opening ceremony of this museum. Here is Virginia Ellen's quote, which reads as, "These were nurses who came from all over, the South, North, everywhere. They came to work at Seaview Hospital because there was a dire shortage of nurses. They were recruited from as far away as the Caribbean and the Philippines. The majority of the nurses were black. They couldn't get jobs in other areas, even though they were very well trained with degrees. White nurses did not apply for these jobs because of the danger of catching tuberculosis. It was a very high risk job. One of only a dozen nursing schools for black students in the country, Harlem Hospital School of Nursing opened in 1923. In 1930, the school affiliated with Seaview Hospital, meaning that Harlem students worked at Seaview as a part of their training program. Harlem School of Nursing closed in 1977. This is the picture of Phyllis Alfreda Hall Lambert. Born in Florida in 1909, Phyllis graduated from nursing school in Florida in 1934 and later joined Seaview Hospital, where she worked as a registered nurse for almost 40 years. Here in this picture, on the left, we see Missouria Lavinia Meadows Walker from South Carolina. A graduate of Freedman's Hospital School of Nursing at Harvard University, Missouria Lavinia Meadows Walker moved to Westerly, Staten Island, to work at Seaview in 1935. She stayed on at the hospital for 25 years and was involved in the 1951 isoniazid trials. She moved on to Beth Israel Medical Center in Manhattan before retiring in 1970. She co founded the Progressive Nursing Club and was a founding member of Staten Island's chapter of the National Council of Negro Women. On the right is Edna Sutton Ballard from Savannah, Georgia. Having attended nursing school in Savannah, Edna Sutton moved to New York in 1930 to answer Seaview Hospital's call for black nurses. She completed additional schooling at Harlem School of Nursing and began working as a surgical nurse at Seaview in 1932. Edna worked at a hospital for 34 years and was instrumental in the isoniazid clinical trials. This is a picture of Lincoln School for Nurses graduates, class of 1940. The Lincoln School for Nurses was founded in Bronx in 1896 as one of a dozen nurse training programs in the United States, specifically for black nursing students. The school became affiliated with Seaview Hospital in 1930. Student nurses at Lincoln trained at Seaview Hospital, and many went on to work there after graduation. The school closed in 1961, and so did Seaview Hospital for TB patients in the same year. Nurses on staff at Seaview Hospital wore uniforms, including pressed white dresses and caps. Uniform design corresponded to their nursing school. To keep warm outdoors, they wore caps made of navy wool. Often, the nurses also wore a pin or patch signifying their school and hospital affiliation. Here you get a view of the nurse's cap, which often represented their nursing school or hospital affiliation. In this photo, Clockwise from top left, that is the extreme left on top, is Salaria Kia O'Reilly from Akron, Ohio. Salaria Kia O'Reilly moved from Ohio to New York to attend Harlem School for Nurses when she led a protest that ended segregated lunch service at the school. She graduated in 1934, taking a job at Seaview Hospital. She later became the only black nurse to join the Abraham Lincoln Brigade, a group of American military and medical volunteers who served in the Spanish Civil War. Then, on the top right, you see Dora Tucker Jones from Norfolk, Virginia. Dora Tucker Jones followed her sister Marjorie Reed to Seaview Hospital in 1949. She worked there for 39 years as a nurse's aide. On the bottom right, we can see Marjorie Tucker Reed. Raised on Staten Island, Marjorie Reed graduated from McKee High School. She began work at Seaview in 1948, graduated as a licensed practical nurse, and worked in hospitals throughout the city. Eventually, she returned to Seaview Rehabilitation Center, retiring from there in 1988. And completing the circle on this slide, on the bottom left, we have Curling Jennings Bennett from Tennessee. Curling Jennings Bennett was born in Tennessee and grew up on Staten Island. She graduated from Bellevue School of Nursing in 1957 and worked as a nurse at Seaview Hospital from 1957 to 1958 before leaving to pursue public health nursing. She lived for many years in Liberia, where she worked to establish maternity clinics and combat infant mortality. She currently resides in Arizona. Here is another galaxy of heroes who took care when the privileged white nurses refused to do so. We can see here Nellie Mae Holmes, Molly Savage, Jenny Williams, Clemmy Phillips, Hazel Pedro Herring, Annie Smith. They were all sisters, resistors, and persisters. The legacy of the Black Angels lives in the stories they told, the families they left behind, and the communities they built. In fact, the nurses at Seaview Hospital often recruited family and community members to the profession, building a network of healthcare professionals that extended beyond Seaview itself. Marjorie Tucker Reed was a nurse at Seaview, while her sister, Dora Tucker Jones, was a nurse's aide. Virginia Allen was inspired by her aunt, Edna Sutton Ballard, to pursue a career in nursing, and they worked at the hospital together. Lucille Herring credits her and her sister Theresa's nursing careers to their mother, Hazel Pedro Herring's work at Seaview. On the left side, we have a photo of the historic first convention of the National Association of Colored Graduate Nurses in Boston in 1909. On the right side, more of golden snippets from Seaview Legacy. Here we can see some more belongings of carers at Seaview Hospital and how they are taking the legacy forward long after Seaview stopped being a TB sanatorium or TB hospital. This photo actually gives us a very important reminder. People in 1950 who had an X-ray screening for TB wore a pin. I had my chest X-ray. In 2021, WHO guidelines clearly stated the critical role of X-rays in screening people with TB, especially those with asymptomatic TB. Finding TB early and accurately is crucial if we are to reduce human suffering, save lives, and stop the spread of infection. Of course, now we have the handheld, ultra portable, battery operated X rays too. Here we can see a replica of the bronchial inhalers made of earthenware. Inhalers such as these were used to treat chest illnesses and diseases, including tuberculosis. Nurses or doctors soaked a sponge with the medicine, and poured boiling water on top. Patients inhaled the treatment through the mouthpiece or vent which was at the top. Fight Tuberculosis Christmas Seal campaign poster of 1919 of National Tuberculosis Association, which is now known as American Lung Association. Beginning in 1907, National Tuberculosis Association volunteer Emily Bissell printed and sold Christmas seals as a fundraiser for a Delaware tuberculosis hospital that was in danger of closing due to funds shortage. The campaign succeeded, receiving national attention and becoming a tool for public health awareness. Christmas seal campaign continues to this day. In India too, we have a similar one by TB Association of India. The Black Angels blazed a trail for generations to come. The names in these photos represent only a fraction of the hundreds of nursing professionals who worked at Seaview. We extend our deepest gratitude to them for their tireless efforts and courage in the face of adversity and fear. Here again, on the right side, is another historic photograph of a black angel nurse, Blanche Newton, giving an isoniazid tablet to a TB patient, Alfred Maddox. While tuberculosis has existed for thousands of years, it was only in the 19th century that scientists began to understand the microbial origins of the disease. During the first half of the 20th century, TB mortality in the US declined, largely as a result of improved nutrition, testing, reporting, and isolation. Treatment options, however, remained limited and patients continued to suffer. The year 1951 inaugurated an exciting new era at Seaview's isoniazid clinic trials proved successful. However, efficacious TB drug treatment brought unintended consequences. Public health funding for TB decreased precipitously in the US for the next few decades. The disease was largely forgotten. However, in many parts of the world, TB is still very much there. It has not declined. Here we get a glimpse of the medical cart and supplies of 80 90 years back. Populated with Seaview Hospital enamel wares and linens, this medical cart carried the supplies necessary for the nurses to take care of their patients. Nurses took vital signs, treated symptoms, and cared for basic needs. They bathed, shaved, and dressed their patients for each day spent on the wards of Seaview. This card represents the space shared by nurses and patients suffering from tuberculosis, a highly contagious and at that time incurable disease. These important books have a special place in the exhibit, including the book on Black Angels by Maria Smilios. As per the latest WHO Global TB Report 2024, over 2 people died every minute in 2023 of tuberculosis. In 2023, 1.1 million TB deaths took place and 10.8 million people got infected with the disease, out of which almost 3 million were missed. Here is the clock showing that as time ticks, how many TB deaths take place every minute or second. Here you can see the dresser from a nurse's dormitory at Seaview Hospital and a coat also along with it. Her calling was to take care of the patients, and she didn't care what disease they had as long as she was able to take care of them and get them healthy. That's the way she was, and that's the way most of the nurses were. This is written by Florence Shirley on her great aunt, Masuria Meadows Walker, whose photo we have seen earlier. This again is a dresser from the nurses' dormitory dated in the 1930s. Unlike at modern hospitals, much of Seaview staff lived on campus in dormitories and cottages. The nurses' residence accommodated 30 staff and provided modest accommodation, a bed, a dresser, chair, and wash basin. This dresser represents not only the time they lived at Seaview, but also how that time impacted the rest of their lives, families, and communities. And here we see the legend herself, Virginia Allen, who's among the Black Angel nurses who served in Seaview, showing me the dresser, one of which she would have herself used back then. Also in the photo is the exhibit co curator Gabriela Leon. Death from TB is caused by human choice. It is caused by human built systems. And so that is terrifying and horrifying and deeply upsetting. It means we are not doing a good job of assigning equal value to every human life. This was said by the famous American author John Green at a panel discussion during the United Nations General Assembly in 2023. And this is so very true. What else will explain 10.8 million people suffering with TB disease last year when we have the tools and evidence to prevent every single case of TB transmission? What will explain 1.1 million people dying of TB last year when we have the best of tools to diagnose, treat, and care for those with TB? TB is a sad but real story of inequity and injustice. We conveniently refer to it as a disease of the poor, but we shy away from saying the truth that those who enjoy privileges, rights, entitlements, and live a life free from hunger, poverty, homelessness, and other forms of discriminations are much less vulnerable to TB. It is the inequity that puts people at risk of TB. It is the social injustices that deny them timely and accurate diagnosis, deny them the best of treatments, deny them social support and security that puts them at heightened risk of TB and even TB death, along with a range of other human rights abuses and violations. In this photo, Virginia Allen and I are seeing a video exhibit at Staten Island Museum. Racial inequities and injustices continue to plague the TB response even today. Most of the TB burden is in poor countries, that is, low and middle income countries in the global south. Even in the rich nations, marginalized communities are at higher risk of tuberculosis. And here we see the spirit of Seaview 2020. The spirit of Seaview represents aspects of the long and rich history of Seaview Hospital and the historic site in Staten Island. The first panel on the left captures the founding of the Seaview farm colony in the 1830s, where people who were experiencing hardships in Manhattan were welcomed, receiving shelter, food, and training. The second panel jumps to the 1900s when the site was a tuberculosis sanatorium shaped by the prominent legacy of the Black Angels. I got a chance to interview Black Angel nurse and inspiration for so many of us and my dear friend Virginia Allen. Gabriela Leon and co-curator of exhibit Taking Care Black Angels of Seaview, which is open at Staten Island Museum till 29 December 2024. While many scientific advances have been made since the times of the Black Angels for prevention, diagnosis, treatment, and care of people with TB, they are still not available to 1.1 million people today who died from it and 10.8 million people who got infected with it last year. Unless we end all forms of inequities and injustices that plague our health and social services and bridge the deadly divide between rich and poor, we will not only fail to end TB, but also force people to live in risky situations that put them at risk of TB and TB deaths and face a range of other human rights violations. It is high time we make the right choice grounded in human rights, racial equity, and development justice. Here are some photos of the overwhelming moment when we met Virginia Allen. Some insights from Virginia Allen being shared with me when we had met on September 27, 2024, in Staten Island, New York. She said, "We were on the front lines of the fight against TB long before the cure came, doing what nurses do: take care of the patients to the best of our ability and follow the doctor's orders. I took care of the children with TB. They were like any other child who would have been at home, very inquisitive and anxious too about being away from their parents. They did require a lot of care, not only because they were sick, but also because of being separated from their families. But I loved them and I loved my job. As I grew older, I realized how important it is to remember those nurses who came before us." Here we see Virginia Allen with co-curator of the historic exhibit Taking Care Black Angels of Seaview Hospital, Miss Gabriela Leon. The exhibit, as I have said earlier, is open for public at Staten Island Museum in New York till December 29, 2024. And here we see Virginia Allen signing copies of the Black Angels, the untold story of the nurses who helped cure TB, that award winning book authored by Maria Smilios, who is adjunct lecturer at Columbia University Mailman School of Public Health. This book was published in 2023. The book celebrates works that affirm the highest value of the human spirit. It won the 2024 Christopher Award in Literature. It was a finalist for the prestigious Gotham Book Prize and was chosen as an NPR Science Friday Summer Read for 2024. The book was also selected as one of the two finalists for the National Association of Science Writers Journalism Award 2024. Such an honor to meet this legendary person. Salutes to her infectious smile, her gleaming eyes, brimming with enthusiasm, and her upright stance. Thank you, Gabriela, for immortalizing the Black Angels through this exhibition co curated by you. Black indeed is beautiful.